There are a number of different ways that we can treat cancer. I think one of the most confusing things for patients is the realization that immunotherapy isn't like standard treatment like they've received in the past. So a lot of patients feel that immunotherapy is very similar to chemotherapy, but chemotherapy actually attacks rapidly dividing cells indiscriminately. So it's not specific for a tumor cell versus a non-tumor cell. It really does attack rapidly developing cells. And so this is actually why patients develop some of the side effects they do with chemotherapy, because we see rapidly dividing cells in the body be affected. So hair loss, problems with GI tract, so some mouth sores, nausea, vomiting, diarrhea, constipation, as well as decrease in blood counts because the blood cells get affected. With immunotherapy, we're actually revving up the body's immune system, meaning we've revved up the body's T cells that are fighting the cancer cells, but sometimes they get confused and those T cells then attack other normal organs, normal systems. So you can get a rash or itchiness. You can have them have attacks in the colon, so you can get a diarrhea with that. They attack the liver, you get inflammation in the liver, and you can have abnormal liver numbers or an immune hepatitis. We also have issues with the thyroid gland, where it attacks the thyroid gland and causes hypothyroidism. So, immunotherapy certainly has a lot of side effects that we counsel patients on, and it certainly sounds really scary to patients when we tell them about everything and anything that could possibly happen to them, and it's pretty overwhelming at times. But one of the things that we really do try to stress to the patient is that we're here to help them through all of it, and while it sounds scary, we have ways to treat the side effects, and so that they really should feel comfortable talking to us about everything that's going on so that we can help them.